and I set this up in 2004, so a long time ago. At the time, we didn't think that the NHS and the Department of Health and the public sector was talking to the private sector in a kind of interesting way. So we started doing events, and our first speaker was Lord Stevens, now former Chief Executive of the NHS. And we have a regular programme of events with really good speakers that speak for a short time, as we've had tonight, and a very fulsome discussion. We hold it under the Chatham House rules, so people are free to say what they want and it's not attributed or in the press. And we get very senior people, and we kind of make it a fun discussion about serious topics in health.
Patient flow is a big thing for us. It's what we do. If I just explain a bit more about Acacium Group, we're a workforce technology and clinical governance business. So delighted to welcome all of you and to welcome Penny and CHN and our guests, and looking forward to the conversation.
Pretty much all our events follow the same format, so we very deliberately start at 6 in the evening. We found that's a really good time to attract people. We always finish by about 8:30, and we, as Pam said, we really try and make our events very informal. So we had a fantastic session about probably a year ago now, looking at the future of primary care, when Claire Fuller launched her report. We've had quite a lot of conversations around digital technologies and how can we accelerate adoption of those in healthcare. We've talked about ways in which the private healthcare industry can really complement some of the NHS core skills and capabilities, so the NHS taking responsibility for population health and the private sector bringing in some more innovative ideas as well as much needed capital and investment. And tonight really summarised or encapsulated many of those different conversations. So we were looking at the role of technology, we're looking at the way in which the NHS can improve core processes, we're looking at ways in which the social care sector, often privately run, can play an absolutely critical role in supporting quality of life for many of our most frail and elderly people in the UK. So those are the topics that we love to cover. We love to bring together a very diverse group of people, and we always ensure that we have great conversations.
Interestingly, people like to come together in person. During COVID, we just stopped doing events online because there were too many webinars in our view. So we kind of closed down at risk to ourselves and opened up again post-COVID because people like to see each other in person after the event. And today, Acacium has hosted us, fantastic host, great venue. And so people, again, are sort of forging their networks over drinks after the event. And again, it's people seeing each other in person. So, thank you.